Lincoln, Nebraska is a city of around 250,000 people, and there are about 50,000 children in Lincoln, Nebraska. Safe Kids is a program that addresses unintentional injury in children under the age of 14. Lincoln Lancaster County's Safe Kids program addresses motor vehicle injuries, sports injuries, pedestrian injuries, and other unintentional injuries. On November 4th, 1993, at the age of 21, I sustained a spinal cord injury in a motor vehicle crash. I was driving my 1993 Ford Ranger to work early on a fall morning. The reason I crashed was that I fell asleep driving behind the wheel. My crash happened in a rural two-lane Wisconsin road, and when I fell asleep, I veered off to the right of the road, and my truck jumped across road, rolled over several times, and when I woke up, I was pinned in the vehicle. They flew me flight for life to the local regional trauma center, Frederick Memorial Hospital in Wauwatosa, Wisconsin. They realized I had a cervical spinal cord injury and I was paralyzed from the upper chest or the armpits down. So with that type of paralysis, I had to learn how to redo everything. Dressing, feeding, driving. What really led me into public health was I felt like I could do more than just talk to individuals or groups of people. I felt like I wanted to get into programming and just the bigger picture of injury prevention. And a lot of what I do can have a statewide reach, but the important thing to get our goals and our objectives accomplished is to establish relationships at the local level. And one of those relationships we rely on a lot is the relationship that the state, or I have, with the Lincoln Lancaster County Health Department.
The Injury Prevention Program is responsible for addressing all types of unintentional injury that occur to Lancaster County residents. A big part of that is done through the Safe Kids Coalition, which addresses injuries to children 14 and under that are unintentional.
Safety is a very important issue. My wife's been an elementary school principal all her life, and what we can do to make sure we have safe schools and then safe after-school programs, for example, safe homes, safe communities. We do a very good job of that in Nebraska.
Our job here at the Health Department is to make sure that those task forces have everything they need to do their jobs.
We're very engaged in our wellness program to keep people healthy, and again, prevent injuries. All of that's very, very important.
Lincoln Lancaster County Health Department in 1996 received significant funding from NACCHO in order to develop a program to address teenage driving on gravel roads. Funding is essential to what needs to be done to protect kids. And at the Lincoln Lancaster County Health Department, we have been fortunate to be able to apply for and receive funding from national sources as well as state and local sources.
Because I felt like my injury was completely preventable, I chose to drive while I was sleepy behind the wheel. I just felt like it was very important for me to talk to kids so they wouldn't have to go through what I had to go through. This is my 6-year-old son, Atticus. He is a first grader at Sheridan Elementary School here in Lincoln, Nebraska. And it's roughly 2 blocks from our house, so he does walk to school. What I want to see happening in Lincoln is the continued progress in having safe sidewalks, having drivers aware of how their actions may lead to unfortunate consequences of crashes. I hope parents understand that being good role models, and wearing bicycle helmets, and driving safely, not being distracted, that it has a direct influence on their children's behaviors. And it's important because injury can affect everyone. It can be devastating. We realize that kids are going to fall, they're going to bump their knees, they're going to skin their elbows. I mean, kids are playing and they're active, and that's what you want. But when those kids are active and playing, you want them to be active and playing in a safe environment.